Well, in 2022, we made a shift as an organization. I came on board and I was asked to create the first strategic marketing department. And when I say strategy, it meant that, I was in with the C-suite and we were making it together, which was an amazingly new experience for me. Well, hello and welcome to another episode of the Leadership Cafe podcast. We've got a great one for you today. I'm Sally Mildren, your host and CEO of Commonwealth Marketing. We're an integrated marketing agency that serves primarily nonprofits and rural health. We're excited to have a rural health superstar today, Khrista Boster, with us. She has more than a decade of experience in healthcare and nonprofit marketing and communications. She has a bachelor's degree in marketing, communications, and in professional writing from Taylor University, and an MBA from Bluffton University. So Khrista works at Woodlawn Health in Ohio, and she and her team won the Community Star Award from the National Organization of State Offices of Rural Health. So when I say superstar, I mean it. And she also has recently won the Rising Star Award from the American Hospital Association's marketing arm, which is the Society for Healthcare Strategy and Market Development. I'm excited. She has really cool case studies to tell and some really important thinking around building marketing strategy for rural health. So Khrista, thank you for being here.
Thank you so much, Sally, for having me. I really appreciate it.
So I want to start our conversation because you have such a beautiful story of how you landed in rural health. And I like to kind of explore people's career journey anyway, but can you tell us a little bit about your journey to rural health and how you ended up where you're at?
Yeah, so my journey started a long time ago. Well, really, hopefully not that long ago, in a cornfield in Northwest Ohio. So I grew up in a rural community, and there had been a car accident on a state route. For reference, a state route is a 2-lane road that runs through a county that isn't really a highway, but it's like a sub-highway. And so in the community I grew up in, it is easier and faster for you to transport anyone who needs medical attention comparatively to waiting for an ambulance. By the time you get to the hospital, the ambulance would have arrived. However, on this day when the accident happened, it was my neighbor's nephew. And so it was a trauma injury and it was a head injury. And the local nurse said we couldn't move him. So I was in the car with my sister and my mom and waiting for what felt like hours. I was told later it was only 30 minutes. I was in upper elementary school. I was waiting for this young man ambulance to come. And he was only a few years older than me. And I really didn't know him. But, I knew our neighbors and I knew their kids. And we had played with their kids. So that had some relevance in a small farming town in Northwest Ohio. And so, we waited for what seemed like aeons. And they finally got there. They got him stable and they got him to the regional health center, which is 30 minutes away. And unfortunately, he passed away, but that just always stuck with me. I didn't know about access issues. I didn't really know a lot about rural health, but I knew that day someone died because we didn't have all the resources that we could have had. Right.
And so years later, I got the opportunity to go to college and come back and to that community, working in the skilled nursing side of things. And what I saw was that the thing that had happened in the cornfield and that tragedy still was going on. People were still driving themselves. I'm still advising my family and my close loved ones that if you have anything, you need to get in the car and you need to drive because, you could die waiting on the ambulance. And that might sound like a far-fetched idea, but that's not. And I saw the same thing happening, different population, but it hadn't changed. Really, the struggle was still there. There wasn't enough ambulances in this rural community to get out to. It's just interesting. So I am in Indiana now, and we only have 3 ambulances for our whole county of 20,000 people.
Wow.
When you think about that, that becomes a lot of access issues, right?
Yes.
So that really started my passion to do healthcare and to make sure that rural communities and smaller communities had the same access that their larger counterparts had. So that it fuels my passion on the days when it's hard because healthcare and nonprofit, I've worked on both sides. It's hard. There's some days you just think I could do, I'm not sure it's worth the headache.
But
Mhm.
I always remember back in the cornfield, and I always remind my team that we're fighting for those individuals. We're
Right.
fighting for access for those individuals who might not get the care they need. My elderly population wouldn't always drive those 30 or 40 minutes
Right.
because that was a long distance.
Right.
And so things went unchecked and unnoticed until they became prominent issues. And so
Yes.
I remind myself and I remind my team many days, we're fighting for those individuals every day.
Right. That's so good. And, people who aren't in rural health or haven't been in rural health, they don't have any idea. They are used to their suburban or urban access to, well, I'm going to pick between these three hospitals, and that is such a luxury that, rural communities don't have. And I think in today's geopolitical reality, that with the Medicaid cuts, with the Medicare rates that were just announced yesterday, they aren't going to change, with some of the subsidies, on and off the books for people, that is a lot of these populations. And so access is challenged at every level in rural communities. And I think it's so important. The message that we're going to talk about today is really ensuring that the marketing you're doing has impact and that there is tight strategy because there's never enough time or people. You have 12,000 hats to wear, and it's really easy. I've been in those boots and I'm on the other side of the table now, but I know that it's never a lack of things to do, but the harder discipline is doing less better
Mm.
than trying to do everything more with less. And so for this conversation, if you're in a small or under-resourced organization of any kind or in rural health, this conversation is going to be really important for you today, and we'll get some notes to you. So, Khrista, I know that you and I had chatted before, and we have very aligned belief systems about how important strategy is in marketing, but in rural health and small organizations for sure. Why do you think it is such an underutilized emphasis in this area?
Yeah, so we're just the ones that put ribbons on things and deliver cookies, right? If you
Yes.
believe that, that is not exactly no. I'm sorry, I'm just gonna shut that down. No. I
Mhm.
think for a lot of reasons. One, we don't always, as marketers, understand the value we bring to the table.
Right.
And in a clinical environment and around many clinicians, and we love our clinical counterparts. We could not do what we do without them. But it's hard to stand up and say, I have a voice and I need a seat at the table
Right.
because what I do matters. And I also think if you think about it this way, it's less than 30 years that healthcare marketing has been a discipline.
Mhm.
Many of our counterparts that we sit at the table with in meetings, their disciplines have been recognized for hundreds of years.
Yes.
So it's an education process. I always share when I first started back in healthcare, when I came back to Woodlawn about almost 4 years ago, I had a doctor who said, no one Googles me. I'm a specialist. And so, there was a lot of educating that yes, people are Googling you and your page matters a ton what we put on there. And your counterpart has more assets on their page, on their website. And so, yeah, they're getting more patients because of that. But I
Mhm.
think it's explaining it. And then it's also being scared to take a seat at the table. I tell this story a lot. I've been really blessed. And unfortunately, they're retiring soon, but I've been really blessed with a great CEO. And he came to me a while back and he said, Khrista, I need you to take a seat at the table. And I was like, I don't want to step on toes, right? I don't want to get anyone mad at me. I don't have a clinical brain. And he said, and I need you that. I need that at the table. I need the strategy side of your brain because if you have ever done anything in marketing, it's strategy. I need your insight. I need your messaging capabilities. I need the way you tell a story because you're the only one at that table who has those insights.
Right.
And so I need to take a seat at the table. And that was so scary for me for many, many times. But he begged me and, made the seat. And then later on shared with me, there's going to be a day that that seat's not going to be given. You're going to have
Right.
to fight for it. And so you're going to have to
Right.
learn to fight for it.
Yeah.
And so over the last several years, I've had to learn, at times he said, I need you to take this on. I'm like, not exactly my jam, but I've had to learn to fight for my seat at the
Mhm.
table and to speak up and to make sure that when I speak up, it has value, but also building those relationships in the room so that people come and say, how would we tell the story to our community? And Khrista, can you help us do that? So creating that
Sure.
partnership.
So good. And I know I actually have an undergraduate degree and started as a traumatic brain injury therapist. So I would have been at the hospital to help receive your friend and worked my way back into marketing communications at hospitals. And I think it's what a gift. You're right. A gift to be invited to that table. Often marketing isn't invited. And I think of Shirley Chisholm was the very first Black congresswoman in the US.
Mhm.
And she's infamously quoted as saying, if they won't give you a seat at the table, bring your own chair. And I love that sentiment because often we don't market what we do well enough to feel confident in a seat at the table. And so I love what you've shared here because I think it's a really important piece of our career progression, but also the impact of the entire profession. And when I think about my journey in healthcare marketing, I got hired initially as a half-time temporary marketing specialist at a hospital, at a suburban, rural-ish hospital. And I worked my way up to director. We had a whole department of one directing myself. And then we had a halftime, and then we had a halftime specialist that joined us. But it was the same thing. And a lot of physicians just don't understand marketing. They do think it's the bow making and the cookies and milk carts, all that stuff. But it was exactly in earning those trusted relationships with the clinicians, with the other administrators, leveraging every opportunity when we're at a meeting and we go around the table and share what's up in our area, making that a valuable contribution and not just a flyer that could have been in the hallway bulletin board. But it's such an important distinction that you call out because you have so much more power than you know if you're a marketer in a
Mhm.
hospital. And I love that now they're at a place where they're coming to you and saying, how can you help me tell the story better? So good. So when we talk about strategy, I know that you've had a couple of your campaigns that were award winning. One of them's Close the Gap. The other one is the Local IQ campaign. Which one do you want to start with? We're going to walk through kind of what was the need, what was the goal, what did you do, how did you approach it, and how did it work out?
So yeah, Close the Gap came about in 2022. Well, in 2022, we made a shift as an organization. I came on board and I was asked to create the first strategic marketing department. And to make, when I say strategy, it meant that, I was in with the C suite and we were making it together, which was an amazingly new experience for me. But we got to so in 2023, we got to October and we had a great plan in place and we had been watching things. But that month, we had something happen and we knew what the problem was, but we didn't know how we exactly were going to fix it. So for all my healthcare people, our physician visits were up, but our ancillary volumes were down. That should never really happen. They should correlate together.
Yeah.
So
Right.
the COO, the CEO, and the CFO and I were racking our brain because what we knew was things were leaving the health system, but we didn't know what was leaving. And at the time, we are on 2 electronic medical records, which if you're not in healthcare, the best way I can explain it is that's the holy grail.
Your
For people,
CRM.
yeah, your
Yeah.
CRM. That's a very good way of putting it. It's your CRM, like,
Mm.
So we were in 2, and when we couldn't see a patient journey. There was nowhere to see where patients were coming and going because the hospital had one computer system and the clinics had another, and they don't talk
Mm.
very well to each other at all. So the opportunity to figure out who was staying and who was leaving was going to be a hard-fought journey. And so this was a project our CEO handed to me and said, "Can you figure it out?" With a lot of ambiguity. So a lot of listening happened, a lot of working with our clinic informatics team to come up with a clinical process and learning what their processes were and how we were going to have to change some workflows with our clinicians. So we figured that out and we found a way to track it. It's going to be a lot of work. So we rolled that out as well. And from claim data, we knew that we were only capturing 50 to 60% of the market. And that is not acceptable in a small
Mhm.
community
Right.
at all. And that is not sustainable for us to stay afloat and to serve the community who needs us. So we did a lot of listening in the beginning and we got our clinicians in. We got a lot of people from the clinic. We did some initial groups and we found out some very interesting things. One, our clinicians didn't know what we offered. We had at the time brought on 4 new medical providers, so a doctor, a physician, or a nurse practitioner, or a physician assistant. And one had sent one back to, she come from a competitor, and she sent a patient back to a competitor. And she didn't do that to be malice. And when we talked, she explained to me she didn't know what we offered. The only way she was going to be able to do that was to call 20 of her other colleagues, which she doesn't have the time to do because she's making a split-minute decision. And there was no place for her to find out what the source of truth was. So that began us starting on a whole journey of creating what we called a service guide. And the service guide was from neck pains for the front desk person to know what was happening, all the way up to a medical term. So we created that, and who did what. We also told our clinicians that we are going to, we gave them many months over, we're going to start holding some accountability when it comes to referrals, and we are going to see what's staying and what's going, and we're going to educate along the way. And so our first month, we were at 26% stayed, which was a heart check.
So 26% stayed or was leaving?
26% stayed. We had over 70% out migration. And we are a tiny facility, and we knew we couldn't do it all. We're very aware of that. But we knew that the things were leaving that we couldn't save. So that began to have us start thinking, well, we need to educate our team on what is happening. But then we also need to figure out, where are we creating barriers? Are there old regulations we're holding to? Are there old patterns that we're holding to that we need to let go to create more access? And so I partnered with patient experience, and we went to every department meeting, and we explained the why, and then we listened to our team. And they came back with some really good things. Some really good things. So we created a whole spreadsheet. We gave that to our C-suite. And then we did a whole town hall, and we broadcast that, and we came back with more good things because the C-suite was actually really interested in what we were bringing back, because some of the things were fixable and some weren't, and some, because of regulation, we have no control over and we can't fix it. But there's a lot of things that were old or things that we are doing extra of that was creating more pain for the patient to get through. And so we did 2 listening sessions. We did one and we fixed things, and we went back a year later and did that. And then in the middle of all of this, we decided that, you know what, if our team has no idea what we do, then how is our community going to know? Because, we had providers or doctors who had been there for 30 years who was so excited to get a list of all the services we provided, because they didn't know. So if they didn't know, how was Joe on the street going to know what we did? So we created an external service guide as well, and we put in all the services we do, and we mailed it out to everyone in the county. And it was interesting, the calls we got, and that's actually one of the best pieces I think that my team's ever created, and one we still use to this day, that simplifies and tells all the services offered, and helps people when we're hosting, the governors coming through to tour, all the way down to the county fair. We're in the Midwest. County fairs are huge in our area, and being able to have that as a resource. So we did that. And then along the way, we created a stoplight report. So every month we put it out, and we shine lights on what was staying and what was going. And then we did it percentage wise. So when we started, out migration was at 70%. 70% was leaving our system. Recently, I just got to present today to our leadership team that we only have 10% now.
Wow,
That
that's
is leaving.
amazing.
So, using those numbers, and, over time, we've gotten way more sophisticated with our calculations. We got a new EMR that's very helpful.
Good.
But knowing how much is leaving, and now we're able to put a dollar amount to that to share with everyone that, when this leaves our system, it has a dollar amount that could impact us as well. So, patients always have a choice. But we can always help educate them with that choice as well.
Sure. And often, patients trust their provider and will just do what they say. So it's a really valid point. And, I've been in small hospitals, I've been in statewide systems that had the same problem, but it's such a common thing. And I think it's so easy in any role, but in healthcare, to make assumptions about what people know or understand or not. And so it's such a great story. I love that. And to have a single source of truth, when I have executed solutions like that in other entities, that single source of truth not only met the problem, it increased the employee engagement, engagement and the provider engagement as well, because it removed a barrier, to your point. So
Mhm.
congratulations on that. That is amazing. Amazing. Maybe we'll link to your online stuff in the show notes so people can see.
Yeah, definitely.
Yeah.
And then you asked about Local Like You.
Yes,
This is one
local
of my
IQ.
favorite campaigns. So we are one of the few hospitals that has an OB. If you're following rural health, this has unfortunately been a trend, and why I've sat in my seat. 2 OBs have closed around us, but before I got there, there's 2 to 3 that had already closed. So 4 to 5 OBs in our area had closed. When we had a few years ago an OB close in a neighboring community, I was called down to the C-suite, and we had very little market share at the time. And I was told that we needed to capitalize on this. We had been given a notice ahead of what the community knew. So we had about a day or two notice. And so I was to create a strategy. And in this
Days,
community,
no problem.
right, we have it down. We
Woo.
really didn't have a lot of things running in that community, so there was no switching out. It had
Yeah.
it been in other communities as well. And so what we did is we got creative because we needed to show that we were part of that community, even though at the time we really weren't competing in that community. But we had a lot of team members who lived in those communities,
Mhm.
who were well known in those communities, who had done 4-H and been in the fair, who were on the school board. Like there, we had
Amazing.
some roots there, and we needed to capitalize on that. So, me and our CEO were going back and forth because I was like, if I have a few days, you're gonna help me, right? Get this done. And he said, well, why don't we do Local Like You? And then I added and caring for our community. So what we
Nice.
did, we had recently, a year ago, had been at their county fair, and we had one of our doctors out there who had taken a picture with the fair queen as a joke. However, that became great publicity for us because
Yes.
we were going back to the fair, and this time we were investing more in that fair. So we put his picture up with the previous fair queen and said, can't wait to see you at the fair, and Local Like
Mhm.
You and caring for a community. But while we were at the fair, we shot pictures of people who had been in 4-H. We took them to the barns and we
Mhm.
shot those pictures, and we took other people. And I went to our leadership team, and this comes into the value of sharing and
Mhm.
making relationships. I said, who in your team? And we want frontline team members
Mhm.
who lives in this county.
Yeah.
And then would you ask them for me if they'd be willing to do marketing? So we had the best story was we had 2 OB nurses who spoke up, and their director really encouraged them to do it. And she said, I'm from this county, so if I do it, you do it, right? And they made that pact. And so it ended up their billboard said they had Local Like You and caring for the babies
Mhm.
of Miami County,
Amazing.
and that ended
Amazing.
up going unbeknownst to me because we took out a lot of billboards in this area because they don't have radio, very much radio that's influential, and they don't have really a newspaper. So billboards was going to be our target. So we took out this billboard, and in unbeknownst to me, it was at the end of one of the nurses' roads.
Mm.
So home run. But it really spoke volumes that we're local like you and we're caring for our community. So we took lots of different team members from our C-suite to our directors to our nurses on the
Mhm.
floor, and we created this whole campaign, and we ran it as a brand campaign along with talking about the OB services that we offered.
Sure.
And we ran that, and it did phenomenal. Like, it
Um,
was out of this world. People were getting texts, and calls, and there's still a few up. If you guys know how billboards run, we're not paying on them, but they're still up.
yeah.
And so I had somebody come in and say, so and so I go to church with wants to know when my billboard's going down so they can go take a picture before it goes down. To the point that we have expanded this for the 3 counties that we're able to serve with OB services. We've expanded them all the way up
Mhm.
through that. So every other month, we're running a Local Like You. And then we tied that in with our Meet the Team Mondays on social media. So it was an integrated strategy because we wanted our community to know and trust our care team before they came in.
Yes.
And so we started, and it's become a huge hit for us. Is we have a small bio that they fill out, and their picture, which is the same picture that's ending up on the billboards, and
Mhm.
it says "Meet the Teen," and then it tells you about the person. And then we've
Nice.
at times had groups do it. So we talk about our amazing lab team and their local like you and serving their community because many of these individuals have grown up here. They went
Yeah.
to school and come back. So the power that they're caring for their own community in itself is a huge message.
Right. That is so amazing. I love that. And I love the Meet the Team Monday. So that's just a static post with kind of a
Mhm.
bio intro. That's amazing.
Yep.
That's
The goal
amazing.
is that
And
they go every Monday. So that's the
yeah,
goal.
that's amazing. And for small communities, that is just magic. It's like you're a celebrity or something if you saw them on a billboard. So that's so exciting. I was reading a book yesterday. A lot of what we do is looking at kind of the art and science of messaging and marketing. And we really try to take advantage of not manipulatively, but in a intentionality way to understand what really resonates and creates connection. And by and large, for healthcare, trust is under assault. Part of it is because of the more broad rhetoric around immunization, around scientific facts, around trusting the doctor, all of that. But so trust has been an issue, but I love the way you've done that because trust is not bought, it's earned. And the way you have paved this road is what earns trust. And trust is that advantage that never goes away. And I think that's why it's so important. We're working with another rural health system, and one of the things that's easy to want to do is to be like the big guy. But when you're rural health, it's about community, it's about us, it's about you and me. And we're in this together. We've been around. We know, I know Dr. So and so, his kids are on my kids' soccer team. And, it's that sense of community. So I love the way you've done that. The permanent advantage is built from that kind of trust, which is amazing.
Right. Yeah, actually, our motto as an organization is earning the right to care for you, your family, and our community.
That's cool.
Because it's earning, you have to earn it, like you said, not trust. Trust is earned.
That's not a singular event, that earning the right. It's
Yeah.
every single time. So I know that we're getting close on time, but talk to me for just a minute about how you got kind of broader buy-in, or was that just a shoe-in because the C-suite was involved? How did you get
No,
other areas to come
right.
along with you? I think that intimidates marketing folks
Mhm.
sometimes.
So I had a huge advantage in that our CEO was pro marketing, but he taught me a lot of things and I had to earn some space on my own. So I think with marketing, we have to be able to tell our story as well as the organization story. And many times that story has to be told in numbers because the people at the table who are helping make those financial decisions for the organizations, they are impacted by the numbers and they're impacted with what is marketing doing for me.
Mhm,
And, we need to be a so I've been taught this and I believe it with my full heart. We are a revenue generator, not a
mhm.
cost center.
Preach,
And
girl. Okay.
but to do that and to show that revenue generation, it's sometimes having to say hard things about ourselves even.
Yeah.
So I always look at all the doctor's visits because visits end up being surgeries.
Mhm,
And I look at the ones that the service lines we're campaigning for.
mhm,
And so when we're doing well, I point that out.
mhm,
So we started a campaign here. You have to give me a few months.
mhm,
And we saw a spike here. And overall, we've seen a spike in office visits because we've been running this campaign.
mhm.
But it's also the reverse side of things when you come back and say, you know what, we've been running a campaign for 2 or 3 years in healthcare. We always are putting out this service line, but it's not doing well.
Mhm,
And so I'm asking for your permission to pull back
mhm,
and to let me reevaluate and to figure out something different. And so
mhm,
it might be a few months where they're not out there, but you got to let me figure out why.
mhm,
So it's using those numbers to be honest, because when you are telling the story to a COO or a CFO or a CEO and you say, hey, this isn't working and I want to pull back and figure out why, the respect and the buy in you will get from that, even if it's saying, you know what, I might not have done the best job, is kind of how it feels to marketing. But when you're saying it's just not working and I need to figure it out,
right.
that will get you a lot more buy in. And I think when you look at the top line revenue, and any organization, and even in nonprofit, when you're looking at what you're fundraising,
Mhm,
and you bring that back to, but look at all that we're helping the organization do.
Mhm.
The CFO will get on board. And the best compliment I've received from our CFO is you and I are working together,
Yeah.
as in we're both had the same goal. And when
Ah.
you get that buy-in, it helps a lot
Mhm.
on the budgeting. So I started as a team of 1, and now we are a team of 2 FTEs or full-time equivalents. And that buy-in happened because, we could tie that up to financial results. Um,
Exactly.
so, even with like the Close the Gap campaign I shared, it ties back to financial results that we saw as, 30% increase overall in the budget. And then that helps when it comes to funding decisions. And it helps, I think healthcare is in a flux right now, but and will help. We've been on a tight budget for a very, very long time. And
As long as it's existed.
right.
Yeah.
So, it's hard sometimes when we wanna trial things to get that
Mhm.
buy-in, but I
Right.
recently had a conversation, I said, "And my gut feels like it'll do it." And, the or the CEO said, "But you have a track record, so I'm gonna trust you."
Mhm.
But it's because we've used those numbers and we've told that story with numbers. So I think the largest part is you have to know the numbers. And I
Mhm.
found that if you don't know them, if you ask, people are willing to share and to teach.
Yes.
So a healthcare balance sheet is not easy to decode. I'll be the first to tell you that. And I have an MBA, so still not easy. But when we use those numbers and when we ask those questions,
Mhm.
and we become good friends with the CFO and they realize that we're working in tandem,
Mm.
there is a lot of magic that happens. And when you
Right.
become a partner with the C-suite and they see you as an asset,
Mhm.
it helps get a seat at the table
Mhm.
way earlier because they
Right.
realize that we need to bring marketing in. So this is cohesive for us.
Right. And I feel like I've had a critical access hospital marketing person say to me recently, well, I'm just not strategic. And I'm like, it's not a gene that is endowed on some. It is just honestly being curious about
Mhm.
wanting to connect the dots. That's really all the strategy boils down to is that I'm not going to just stay busy, burning myself out, working every weekend and late nights and not have any idea if it worked. I want to do stuff that makes a difference for the organization. And that's where we always start is what is on the thumb on the guy you report to or the gal you report to? What are they on the hook for? How can we make sure that our initiatives are doing more than just general brand awareness? Brand awareness is important, but it can't, at the end of the day, have any much attribution to it. So you're right. I'm married to a finance guy and I always in every healthcare position I've had, I made friends with the finance guy, the CFO, the revenue manager, whoever that person was, COO, made friends with that individual because it was vital to know what's the baseline. Okay. Now we're going to run this campaign. Have we moved the needle? We're in touch with the clinic managers or the schedulers or the receptionist, whoever that it is in your system. I think it's just so smart. So
Mhm.
smart.
Well, I think you bring up a good point. I know we're getting close on time, but I want to share, that isn't just something that you tell the person you report out to. That's something that when you're going around the table in a leadership meeting, you're
Yes.
sharing. That's
Mhm.
something that when you have the opportunity to go to a provider meeting, you're sharing. And if you're working with an individual provider and you share that, that helps out as well. And then if you ever have the opportunity to present to your board, that is
Mhm.
showtime to share with them
Yes.
what you do because marketing is a team sport. And if you're in a
Right.
small organization, we can't play alone. And we
Right.
need everyone to help us get content and to create content. No one is capable of creating all that content on their own. So when you tie that value back, it
Mhm.
will help out immensely in getting what you need to the point that you'll be asked, can I help do X, Y, or Z? Or, hey, I need to do
Right.
a podcast because I need to teach my patients this. Those are the days that we've won.
Yes.
It might take a year or two, but those are the days you've won.
In a job market overall globally that is tenuous for a lot of industries, the advice you're giving is the shortest and most safe path. It's not bulletproof, but it is the shortest and safest path to job security for you. Because if you can demonstrate you're not just a cost center, you are making impact that is moving the needle for the organization, then you aren't the first place they're going to look. If you're only tying bows, you're the first place they're going to look. So that's why we preach this in the Leadership Cafe as well, our online community. And we have lots of presentations about building a budget that your CFO will love and things from our decades of experience in doing this work. So, Khrista, we're so grateful for you being here today. Congratulations on all your success. And I'm sure that we'll be seeing more of it because you're very bright and intelligent and motivated. So that's great. If folks want to check out your work or get in touch with you, where should they look?
Oh, I'd love to connect on LinkedIn. So it's
Okay.
Khrista Boster, MBA. My name is differently spelled. It's KHRISTA. So I don't think there's a lot of us, but I'd love to connect. I love seeing
Sure.
what other marketing teams are doing, especially in the smaller team space.
Yeah. And we'll put your link in the show notes. And if you want to hop into the Leadership Cafe, you're welcome to be in there and share, ask questions anytime. We're happy to do that. And listeners, thank you for joining us today. We're so glad, so grateful that you're here. And if you have a question or comment, want to give us a like or a follow, we would love that too. So make sure that you stay tuned because we release fresh brewed episodes every other Thursday. Thank you for coming.